Have you ever wondered how shifts in policy can impact the future of cancer research? Today, we delve into the recent changes at the National Cancer Institute and what they mean for millions of people. In a surprising turn, actions by the Trump administration have sent shockwaves through the National Cancer Institute, a beacon of hope in cancer research for decades. This upheaval has led to an exodus of dedicated scientists and clinicians, sparking concern over the future of cancer research in the United States. Historically backed by strong bipartisan support, the NCI now finds itself grappling with significant setbacks. After years of progress that saw cancer mortality rates decrease by a third since the 1990s, funding cuts are threatening to undo these gains. Critical research projects and training programs for new oncologists have been halted. One staff member likened the situation to a drone attack, with grant terminations happening unexpectedly and from above. Why does this matter? For nearly 2 million Americans diagnosed with cancer annually, these developments could slow down critical advancements in treatment and care. In 2023 alone, cancer claimed over 613,000 lives, making it a leading cause of death. Yet, thanks to robust investments in cancer science, there are now about 18 million survivors across the country. We're winning, asserts Karen Knudsen, CEO of the Parker Institute for Cancer Immunotherapy. Why we would let up, I really don't understand. This sentiment is echoed by many within the NCI, who fear that current policies could hinder life-saving research efforts. The emotional toll is palpable among staff who've dedicated their careers to this cause. One laboratory chief lamented losing 6 team members recently and expressed doubt about their ability to sustain operations much longer. Consider Mike Etchemendy from Big Bear Lake, California, a testament to how vital NCI's work is. Since 2013, he has participated in several clinical trials at NIH's Clinical Center for his rare bone cancer. To him and many others, it's known as the House of Hope. Thanks to innovative treatments and expert care, Etchemendy believes he's gained a decade of life. He worries deeply about what funding cuts mean for future patients. People come from all over the world to learn there, he says. You cut funding there, you're going to cut major research on cancer. Reflecting on these changes prompts us to ask ourselves, are we doing enough to ensure continuous support for such crucial institutions? How might these shifts impact not only current but future generations seeking hope against one of humanity's most formidable foes? The restructuring at NCI raises questions about priorities in health research funding. According to Andrew Nixon from HHS, this represents a necessary transformation aimed at focusing resources on high-impact research free from ideological biases. However, many within NCI view it as an unsettling departure from its foundational mission. Efforts that are life-saving now are being curtailed, warns one scientist gravely. People will die. The legacy of consistent government support through initiatives like President Nixon's War on Cancer is under scrutiny, as Congress continues allocating billions annually towards cancer research. Yet internal discord suggests potential hurdles ahead, particularly concerning diversity-focused studies, which some fear may be deprioritized. As changes unfold under new leadership such as Jay Bhattacharya's directorship at NIH, without clear communication regarding future commitments towards minority health studies, questions linger about what lies ahead for those relying on continued innovation against diseases like cancer. This moment invites us all into an essential conversation around how best we can advocate effectively, not just within scientific circles, but as engaged citizens invested in shaping public health policy moving forward. What role can you play in supporting critical scientific endeavors? Let's continue exploring ways together, where our voices amplify progress toward better health outcomes worldwide.